Good evening, all. Today, I just wanted to speak some few words, a short video on Bppv, that is benign paroxysmal positional vertigo. What is that? It is basically a sensation of spinning called vertigo, spinning of the whole room. For example, if you're getting out from the bed or moving your head, rotate, or almost the same room is spinning around, that is called as a vertigo. So vertigo, it's a paroxysmal positional, some position alters, we have the changes of sudden onset of spinning, the head position. There are three types of canals which is present in the ear. The problem is happens mainly due to the inner ear. So what are the three canals? There is an important canal called a semicircular canal. In that, the three canals: anterior canal, posterior canal, and horizontal canal. So there is a fluid which is filled, which is commonly at right angles in the semicircular canal. That fluid is called endolymph fluid. So BPPV occurs as a result of a process called as otoconia. So what happens? There is a small tiny crystals called a calcium carbonate, which is mainly detached from the otolithic membrane, which is present in the inner semicircular canal ear. So that calcium carbonate crystals which moves around. So what will happen automatically collectively in the semicircular canal? So the gravity which causes otoconia. So this stimulates the cupula, an important part in the ear, cupula, to send the false signals to the brain. Some sort of things which happens like false signals which sends to the brain, and that causes a vertigo, spinning. And this triggers another important change called as nystagmus, some sort of involuntary eyeball movements. So what will happens, this otoconia occurs mainly by the utricle in the posterior semicircular canal, which is very common. So once we diagnose which canal which is affected, very commonly this calcium carbonate crystal changes occurs in the posterior semicircular canal. So very rarely which is happens in anterior canal and horizontal canal. So this is called as a canalolithiosis, and which is attached to the cupula. Sometimes it may called as cupulolithiosis. So BPPV may be unilateral in single ear semicircular canal. Sometimes it may be bilateral also. Right side, say for example, patient used to say right side rotation, they may have a spinning, or left side rotation, they may have a spinning. They cannot able to lie down supine comfortably. So these type of problems which is very common in canalolithiasis posterior canal type of BPPV. So very commonly the symptoms are lightheadedness and imbalance, not able to walk freely, some sort of balance problems, and some sort of vomiting like sensations, nausea. So how this happens? Looking up or rolling over or getting out of the bed, this is a common symptoms. So what is the important causative factor to produce this BPPV? Under the age of 50, commonly head injuries, concussions, which causes otoconia. BPPV also associated with migraine or virus in the viral infections in the ear, Meniere's disease, or the classical evidence based best important thing we must do is to check the BPPV by clinical tests. There is no blood test or other things. It's called as a Dixhalpick test. It is a classical evidence based test. So the patient is able to move on the seated position, long seated position in the couch, make them to come for a supine position, and ask the patient to turn the head 45 degrees either to the right side or left side, which the problem to be held out 15 to 20 seconds we have to turn the patient and keep in 45-degree um, turned around the head and check for the nystagmus to identify whether the involuntary eyeball movements nystagmus is upbeating or downbeating. So according to that, we can confirm the canal. Very commonly the upbeating which confirms the posterior canal. So this maneuver is an evidence-based one. How this surprising thing which identified, which noticed by me, is one common thing. I have got a call from one important patient, so who told me I'm having such a problem, and a neurologist and ENT doctor suggest me to do eply maneuver. So I don't know what is eply maneuver, and I searched the YouTube videos and check out there is an important classical test called as Dixhalpick test to find out which side of the canal it is affected. Then after that, how to sort out the problem. So that is called as canalith repositioning technique called as eply maneuver. So how to do this? I just searched in the YouTube, and finally I came to the conclusion called as a channel Defeat Dizzy. So Defeat Dizzy was designed by whom, that is Mr. Saravanan Chokkalingam. He is a great physiotherapist, senior of mine, completed his graduation in Kekenagar, and he went to United States and he is practicing only Bppv, vestibular rehabilitation technique. He is a renowned practitioner in United States and very recognized. He is conducting a fellowship programs and lot of course by APTA, American Physical Therapy Association. So he is traveling worldwide. So I approached him directly and find out how to do the Dixhalpick and eply maneuver. And I applied to the patient, and the patient got recovered. So I have been approached, keep on approaching my senior Saravanan sir, and I have treated 5 to 6 cases and got succeed in eply maneuver. Most commonly I have noticed posterior canal. One of the last patient I find out having both posterior as well as horizontal canal involvement. So how to rule out the horizontal canal? There is a test called as a rollover test that is also guided by SIR only. So I have tried that rollover test also and applied a horizontal canal technique also. The rollover test itself at treatment. So we have to do. So these type of techniques that we can learn through the special courses conducted by such a renowned person. And I just wanted to say some few words about evidence also. I have noticed some systematic reviews in the research articles. This has been proved moderate to strong evidence. This posterior canal, canalith repositioning technique, eply maneuver, proven to be the best technique. And even in clinical practice guidelines, I approached Saravanan sir and he sent me some few articles also. So I have gone through so far the past 20-25 days, and I wanted to put a video and create an awareness in this vestibular rehabilitation exercise technique, which has been done comfortably to the patient and get succeed by only by physiotherapist. So this awareness videos has been created to a lot of ENT surgeons and neurologists, and those who are watching medical physicians also can refer the cases to the trained physiotherapist in vestibular rehabilitation and techniques. This is an evidence-based one. So apart from the medications, this type of a technique which completely cure the problem of the patient who is suffering from Bppv. So everybody do this training and apply for the patient who is coming with a challenging task. Very rarely we used to get this type of cases, but one or two cases, if we handle this appropriately, the patient can get wonderful improvement. Thank you one and all.